Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
We can stop the slides and go to Dr. Curry.
Okay, I'm right here.
Hey, welcome, Dr. Curry.
Thank you.
You've become a person of
okay, no worries.
Of popularity over the last month. And we wanted you to tell us about how things have gone with your most recent campaign. Let me tell you a little bit about Dr. Curry first, because Dr. Curry is one of the most active pastors in the district. He's involved in almost every campaign that is about anything. If you look on it, you see Dr. Kendrick Curry. And his background is very interesting because in many ways, he has a background like Marion Barry, because you have a degree in biochemistry. Or is it chemistry?
It's chemical engineering.
Even more so, chemical engineering, which I found to be one of the best ways to prepare yourself to go into medical school, because the chemical engineers, they learn how to take care of things and take care of business real well. And as a pastor, Dr. Curry has done that. It's interesting. Every group that I look into and find out what's going on, there's Dr. Curry's name. And so here again with the vaccine is Dr. Curry. And why don't you tell us about how this all happened, that suddenly you became the face of vaccination in the community?
Well, thank you for allowing me to be with you, and certainly it is just always good to be with you, Dr. Callender, and thank you, Mr. Tatum, for calling my office and making sure that I got out of one meeting into another. It's a very, very interesting season that we're in, and it's only by God's grace that we've been able to engage in the things that we have been. I tell you, our desire to be the hand and feet of Jesus has led us down an interesting path. Last year, close to this time, in a week or so, it'll be a full year, we had the onset of the pandemic as we know it. And during that time, our church was looking forward to how we might help some people. And we began to use our strategic partnerships to begin to look at ways of initially doing food distributions as we were able to scale up and then go forward. But also we were working out opportunities when testing became available to become a test location. And so we started with food distribution, and we were able to have things that were scaled up and develop a sustainable mechanism for that. And we were also, by late May, from March to May, we were able to set up a testing facility, develop the infrastructure for that, and then begin to move forward. We continue doing food distributions in a major way. We also have added clothes to it, and we've tested over in a day. We've done more than 300 tests of COVID in one day, and we still do food distribution for well over 2,000 families. And what we were doing was setting up infrastructure so that we began to reimagine and repurpose our building and our parking lots and how things are done, because we've always been done work in ministry with the community. We do mental health ministry in partnership with MBI, and that has helped us set this infrastructure up so that we have not only a ready-made population, but we can address the direct needs of the community. And as such, we've been able to go into the community and find ourselves ready for when vaccine is made available. And we've been, asking the question since last August, and the vaccine became available last December. And as such, we developed a pilot and a plan for how churches and houses of worship could be used as vaccination locations. And since we had already built the infrastructure from doing the testing and from looking at how things flow with regard to food distribution, we worked with the Department of Health, where I sit on the Scientific Advisory Committee. My background, as you heard, Dr. Callender, I have a PhD in chemical engineering, but I'm also trained with Masters of Divinity and Advanced Studies in theology as well. I have Masters of Divinity and theology in terms of preaching and worship and what have you. So in doing that, we've been able to launch a pilot, and the pilot launched on February the 10th. And we were able to vaccinate in that first pilot, the first day, 125 or 30 folk. And then in the course of the next couple of days, we went over 100 as well. So we totally vaccinated over 300 and about 25 to 30 persons. And that's even in inclement weather. And we demonstrated that, a church and a house of worship in the District of Columbia could do such. And we've been able to sort of work and refine this model. And in fact, even on today, we're having a new church in Ward 5, because I'm in Ward 7. And the focus in the city is on Wards 5, 7, and 8 right now. And to get uptake in terms of vaccine. And we're looking at New Samaritan Baptist Church is the church where there's a new vaccination clinic, and it's built on the model that we worked on and worked out at our church. And then we look for it to go throughout the houses of worship that make themselves available, in particular in Wards 5, 7, and 8. And then as the new vaccine becomes available, it will be later. I believe it could be at a number of houses of worship in the various quadrants of the city. So this is something that, we're passionate about. We're doing, to be clear, first doses as well as second doses of the Moderna as well as the Pfizer. And then when the Johnson & Johnson comes, that's one dose. And hopefully we can get enough vaccine into the arms of those in our communities so that we can stop dying, and that we can choose life and have opportunity. And we're really, really serious about that, because disproportionate numbers here in Ward 7, where I also live, in Ward 8, are actually dying, and they're still engaged in super spreader events.
Hey, I'm a little sub, but I'm in the land of the living.
And this oh, someone else.
Somebody needs to go on mute.
That's Rochelle. John Tatum. Tatum, can you mute Rochelle Brown?
Where did you get it from? I was over at Six Flags.
Okay, go ahead. I'm sorry. I apologize.
Not a problem at all. It's because I was pretty much done. But I wanted
to ask you. There's a statement that where there is no vision, the people perish.
Absolutely.
And there's an association. Some people believe in luck. I don't. I recognize that what people call luck is when opportunity meets preparation. And surely. I think you have put into practice all of those things that what Jesus actually ordered us to do, not to talk about or pray about or preach about, but to actually do it. And it's just wonderful to see somebody who's taking your visions and taking it and made a dream, that an impossible dream become a reality. And Pennsylvania Avenue Baptist Church came the lead point in terms of the churches who were now taking the vaccine to the so-called unreachable people, because that's the group that is still a concern for me. The people who are older, can't use the computer well, can't use the telephone, disabled one way or another. And so tell us about your visions in terms of the next steps you see in terms of how we're going to reach some of these more unreachable people.
Well, yeah, thank you for the question. It's a great one. And one of the things we're doing, there are several matters that have come up, and they've always been there. One is the digital divide. Many of the folk in our neighborhood have a double challenge. One is that they don't have internet in the area or in the internet capability, and two, they don't have appropriate devices. So we're trying to look at seniors, because I am the state president for AARP. And a member of Chapter 3473, Penn Branch Chapter. And we're very excited about how we can think through ways of making sure our seniors have opportunity to get connected. So what we've done, even in these vaccination trials, is add a call-in component. We've added where people can actually call in and say, you know, I'm not sure how to use the computer or how to get into the portal, and we will help register. That's what we've done.
Wonderful.
But also, one of the things that, I've been really working on, I have some seniors that are immobile due to a variety of different reasons. And many of them don't leave their buildings that they find themselves in or their homes. And so we're working on how we use nurse practitioners along with health workers to set up a mobile unit for those so that we can vaccinate. We do have some issues with regard to once we open a vial of vaccine, we have to use that whole vial within a period of 6 hours. And that can get dicey as you begin to deal with matters of traffic. So if we can find cluster groups of folk at a given location, then maybe we can set up one of the vaccination setups that I've had at the church, or one of the other models that we've modified to go into other locations, and we can vaccinate a number of given individuals at that location at the same time by going door to door, basically, and being able to vaccinate them. And those are some of the things we want to do, particularly for the seniors. Social isolation is one thing, but social isolation in COVID is something else. And we're finding, seniors that are definitely being socially isolated, and those that do not have capability with Zoom even more so. So we're really trying to think through that and work on that from a church standpoint, from a city standpoint, and because I represent as lead volunteer 85,000 more seniors in the District of Columbia. We're trying to make sure that everybody that desires a vaccine will be able to get one.
Well, it's wonderful to have a visionary like you who has that background. It's interesting how sometimes we think that we have one background and we don't understand how the Lord can use that background. And you use all of the elements of your background to make an impossible dream become a reality. And praise God for you and your vision and your mission. The floor is open for any other questions you want to ask Dr. Curry.
I have a question. Dr. Curry, what is the liability side of providing vaccines? I mean, through the church. I'm real interested in that.
Yeah, so the liability side is carried by the vaccine administrator. We've talked in detail with regard to that. So the flow of vaccine comes into the city. It goes through federally qualified health centers, and then it has to be administered by an approved vaccine administrator that comes through the federally qualified health centers. When you look at it that way, you follow the chain of custody of the vaccine. And because each vaccine is registered nationally, has a barcode, etc. But what it helps you to do is every federally qualified health center, as well as every vaccine administrator, has liability insurance. So since this is for the greater good of the public health, DC's laws and others have made some adjustments, have allowed these public clinics, like they do with mass vaccination, let's say at Six Flags or whatever, to have no challenges with regard to liability, as long as the group that is doing the actual administration carries their liability policy with regard to medical mal and malpractice, etc. So that's an excellent question, and we get it all the time. In addition, we even have proof of insurance, and we hold harmless those who are, that even have the laboratory where the vaccine is stored temporarily before. So that, I mean, there are a whole host of chain of things that we can do, but we have been able to make it through and negotiate that process very well, and we're confident that we don't have any legal problem. Perhaps the greatest challenge that I was most concerned about with regard to legal challenges is, quite frankly, to make sure that the parking lot was clean so we don't have a slip and fall. But you know, that's covered like it would be covered for anybody that would attend the church, and that's those are things you have to think about. The worst thing in the world is somebody to come out to get a vaccine shot for COVID and then to fall. So you have to sort of think through and in sort of a real way all of these things that are can happen.
Thank you so much.
Yes, ma'am.
Dr. Curry, you mentioned the latency of the vaccine. You have to use it within 6 hours. You guys have one of those ultra freezer units to store the vaccine in?
No, we do not. And what we've made available is from the federally qualified health center. They receive a distribution of vaccine, and they are the ones that have the freezers. We receive the vaccine frozen earlier in the morning, and then it has to thaw. It takes about 30 minutes to fully thaw. And we have the containers that you have to keep it in once it does begin to thaw. And so as it goes throughout the day, they have portable containers that you're able to use with regard to the vaccine, and that those will last you. We've been running clinics from 10 a.m. to 4 p.m. and those generally last. They're set to last from 9 a.m. to 6 p.m. at the temperature. It has to be kept at 3 degrees Celsius, and I would have to convert it to remember what that is Fahrenheit, but it has to be kept at very low temperature, and then it is then brought up to room temperature so that it could be used. And so that's one of the things that we have to do. So yes, we have a small refrigerator that's in the mobile unit that comes that is used to hold the virus and while it's being used for vaccination, but not the large freezers that are necessary to do large scale viruses, because that does present a scaling problem. We could put those in, but with the onset of pending approval even this week of Johnson & Johnson, that can their vaccine can sit at room temperature for days, and you don't need all the freezing components. You're going to see a massive switch, and it's only one injection or one shot, vaccination shot. You're going to see more and more folk get that one. But now, when we get that is going to be a huge question. But up until then, I encourage everybody to get Moderna or Pfizer.
Dr. Curry, I have a question for you. My
Yes,
name
ma'am.
is Maya Thorpe, And I want to congratulate you. You have a very good leadership skills. I think you should be the director of health in Biden's administration.
Well, thank you.
Excellent, excellent. Everything that you presented is thus what we need. I'm also a retired registered nurse and I'm a chaplain. And I am very impressed by you. And your sensitivity to the senior citizens, what you talked about, that is 100% right. And I am completely illiterate, do not know zero about computer, you know. And people keep asking me about computer, do this, do that. I don't know anything about computer. And my husband has banned me because I don't know anything, you know. So I thank you for being so sensitive to elderly senior citizens, because I find I'm a convert from Hinduism back home, you know, and uh, this is the only country. I mean, there are a few people that have, you know, respect, but it's not like Asia and Africa. We have a lot of respect for elderly people, you know, it's like gods. And your concern and your love for the senior citizens, I am so touched. It makes me to cry. I want to thank you, thank you, thank you. And I hope somebody will see that you should be the health director. Thank you.
Bless God. Well, certainly, I just applaud you for your even the testimony right there. That's a move of God, and thank you for sharing just briefly your story about your conversion, because that's significant, and we do care. People matter in all of this, and our seniors are among those who are most vulnerable. As part of the DC Health's initiative, one of the things I did, and it's like I didn't need anything else to do, but I felt an obligation and a call to do the work with the Scientific Advisory Committee, and in particular, work with the ethics subcommittee of that committee, because that is the one that looked at these particular rollouts of the vaccines. I'm like, well, what about our seniors? How, if we had a number of ethical issues, one, whether or not, you know, we go immediately into nursing homes and other locations, how do we take care of them there? And then how do we begin to think through and pray through what happens with regard to seniors when they need to be vaccinated, but their caregivers don't want to be? I mean, there are a number of different challenges, and we've been trying to work through that and pray through that. Thank you, thank you, thank you for people like you who are chaplains and who really understand the dynamics on the ground with regard to working with people. I thank you, Ms. Thorpe, for that.
I have a question. This is Dolores Saunders.
Yes, ma'am.
The seniors, the difficulty that I've seen, I've helped a few seniors, and while we were having speaking this morning, I just registered my 92-year-old mother. Well, DC's site is so confusing because the site actually kind of crashed, and then it wouldn't refresh. But then as I kept just hitting it, it would go on to the next page that you needed to go on. Well, that right there will cause a lot of people to be discouraged, and just not, if you're not computer savvy enough. So how can we get more people, I guess, maybe to volunteer, to be able to, or sites where seniors can go, where people are there so that they can sign up?
Yeah, one of the things that the mayor has, and she's knowing this even more personally now because she just lost her sister due to COVID. One thing the mayor has through the Department of Health now are called vaccine buddies, and these vaccine buddies are aimed at helping folk navigate the process and then learn about the experience. That number, I don't have it in front of me, but it's with regard to DC Health, and they need more volunteers to help out and become those advocates for those who are the most vulnerable, which are your seniors, and those who don't have computers or internet, or devices or internet, let me say. Yes,
And
ma'am.
I noticed when took my neighbor to get hers, when we were leaving, the lady gave us a piece of the card, but then gave us another piece of paper that we had to sit and wait, but sign up to get your next shot. So I said, but then that site didn't work. And it was a process of trying to, wait the 15 minutes, but also trying to get her signed up with my cell phone to get her second shot. So I got her signed up. So while we were sitting there, I had a couple of other ladies that asked, well, can you help me? And I said, well, this is absolutely ridiculous. If we're right here at the site, why is it we can't have people that want to volunteer to do this? I'll take my laptop and go in and help and do it. But why aren't there people there that can actually help people to sign up to get it instead of people going home trying to get somebody to help them?
You're more than correct in what you say. That's one of the reasons why I really push to try to have a vaccination site at the church. When you're engaged in pastoral care, you're engaged in the care of the soul.
Okay.
And as you're in the care of the soul, you are looking to look at another's welfare, not just trying to get them in and get them out. Now, the health system, it's a good system in that they try to get vaccine in the arm, but the caring dimension that's built into a process is not necessarily there. These systems are not designed with bedside manner as a part of the framework.
Yeah.
and I want you to understand one of the reasons we did this at the church, because let me just be clear and very frank. When we deal with the Black community and the brown community in particular, we are a different type of people than those that may be in other communities. So therefore, we may need some special attention. We might have a few questions. And if we have the challenges, we need somebody there. So what we did at our site is I ran 2 different shifts of 4 to 6 people, volunteers, to help out with problems just like you're talking about. Everything from how to get to the restroom, to how to get registered, to do you know about this vaccine? I even put on videos with Dr. Makia Corbett to let her talk about the vaccine and her role in invention, because it's Black History Month.
Mhm.
So we made sure that we were trying to do all of these things. And you're absolutely right. There's necessarily a volunteer core that needs to be there. And we had to deal with that. And I had to even talk to people who would bring their parents to get them vaccinated.
Mhm.
But at the same time, they said, I don't want to fool with this vaccine.
Right.
So, and I mean, that in and of itself required some training,
Mhm.
some education, awareness with regard to what is the vaccine? How is it attacking the body? How do we look at dealing with the pandemic? How do we look at making sure that we can be vaccinated? What are the differences? So we go around and deal with all of that. You're absolutely right. Volunteers, and in the future, you will see more health workers from your health ministries at church have to engage in activities like this.
Okay. And it's another
Dr.
thing when they say you can register.
Mhm.
And like, if I want to get my mom her shot, she's with me, but I can't get mine. But it says if you have underlying medical conditions, and I'm like, okay, then that's me. But when I put my information in, it told me that we're only vaccinating people 65 and older. And if anything comes available, we'll let you know. So now that's a two-headed sword.
Yeah, that very much is. And so one of the things that's another one of those concerns that comes before our ethics group. And there's been a rollout phase. And there's 2 matters that deal with that. One is who should be first. That's always there. But another thing is that we don't have an adequate amount of vaccine coming into the city.
Okay.
Just like we didn't get all of the monies that should have come from our COVID relief from the federal government because the previous president decided that DC didn't need as much. And then we likewise have been shorted on the vaccine, and we're just now trying to get that up and going. So one of the things that is being done is to make sure that you have adequate supply.
Okay. Okay.
That supply is going to change the equation. That's why, I'm asking folk to be patient, because Johnson & Johnson won't be out until the summer. It'll be approved this week, presumably, but it won't be out till this summer. But that is a much quicker distribution, and they can get more of it done. And the reason they can do that is they've had experience, because Johnson & Johnson used the same sort of protocol that was used when the Ebola crisis happened, and they were able to vaccinate a significant number of people in Africa and Asia. So I do want you to understand that this is a very challenging matter, but vaccine scarcity is real.
Okay.
And that's why we're experiencing some of the additional heartache that we are.
Okay. Thank you.
Dr. Curry, I think with faith-based initiatives, which I think from my experience is one of the best ways to really have a reach into the community, but there's some other issues too, because our churches are not limited to a specific geographical area.
Right.
And especially here in the DMV, our memberships come from all over, which also poses a logistical problem in terms of how we operate and how we strategize and how we plan our programs. Do you have any advice about how you handle those kinds of things? Because I have friends that belong to your church that don't live in DC.
Yes.
How do you handle that? I mean, because it is an issue, and especially with Black and brown people, because we take care of our relatives who are all over. And I mean, how do we manage that?
So what we've done in the rollout, and that's an excellent question, thank you. What we try to do in the rollout and have some discussion around is who should receive the vaccine. Should it be those who are just living in DC, or those who live and work in DC? And it was decided that based on the supply, it's those who live and work in DC. Now you have to ask the question of which ones. So the challenge has become, there are many that do not let's say not work in DC, but they do a lot of care in DC. And so right now, the mayor just recently announced that all health and social outreach workers can now be vaccinated, go onto the site, log in, and be vaccinated. And they also have, in addition to that, number of special initiatives where small numbers of people who are credible and trusted messengers and caregivers can be vaccinated as families, as a family member or extended family member, because they care for family members. But that's in small, very small groups right now. Prayerfully, we will be able to talk through and work out something where we'll be able to expand those particular groups, because that's going to be the key. And I'm thinking, unfortunately, that's going to be sometime this summer before we can actually answer that question. The only other, possibility is to have the president declare DC over everybody else an emergency site, and then rush in more vaccine from FEMA, and then that would start to balance. But then the other states say, what about us? And so I can see that being even more of a national crisis. The answer is, until we can ramp up production, which you got a lot of chemical engineers doing that scale up and doing all of that other stuff to produce so many. And to be clear, the vaccine has to meet a certain specification. It also has to meet a certain it also has to make sure that it meets a certain amount of we have to eliminate as much human error as possible. So while they're running 24 hours a day, 7 days a week, just like we're in wartime, there's still some error that with regard to vaccine production that we have to seek to eliminate. So all of those things affect the supply chain, and that's why we're in the situation we're in.
We need to keep the Proud Boys out of DC to stop some of the spread too.
I totally agree.
Reverend Curry, is there any vision like for maybe mobile units going into the various communities, like, you know, the library, books on wheels? Yeah. Is there any vision for that that could reach some of the seniors and, you know, and get more people vaccinated?
You're absolutely right. Yes is the answer to your question. As I alluded to earlier, with those who are immobile, taking some sort of setup. Well, a setup of a mobile unit going into their location is very, very critical. But the key is that once we open these vials, every vaccine has to go into an arm, or you start to have vaccine waste, which is a legal offense that they've added into this. And we have to make sure. So we can't have a situation where someone, you say you want a vaccine and it's one person in one building. We have to vaccinate several persons to try to get rid of as many doses in a vial as possible, or then you're liable because the vaccine starts to go to waste and there's already a scarcity of vaccine.
So how do you advertise that you have extras? For example, you know, you meet the quota and you have these. How do you let people know, hey, you need to come real soon because we have all this extra, we need to get it out? How do you advertise that?
That's advertised a number of different ways. That's advertised if you're in your medical network, like Kaiser or like MedStar or GW. They notify folk within their network. But Safeway, Giant, and those, they also have a list at the pharmacy that toward the end of the day, around 2:30 to 3 o'clock, they notify everybody that they have to get rid of X amount of vaccine. And believe it, if you want to go check it out, in Ward 8, you have a number of folk from Ward 3 that will come over and stand in line and wait. But it's about 2:30 every day that you find a clinic that someone is tallying up to see what we need to do to close out so we don't waste the vaccine. We even have a standby list as well. And last week when the weather was not quite as great on last Saturday, we had folk come in and we had maybe 7 or 8 folk miss appointments. We started going down the list and calling on our standby list. So many folks showed up, we didn't even have enough vaccine. Because you have to be able to get there in 30 minutes.
Yes, Pastor Curry, please.
Yes, ma'am.
Thank you so much for what you're doing. But I'm starting to get a little bit teary-eyed because the problem that I have right now is because of my passion. Is that this thing is so stressful.
Yes, it is.
And you have no idea right now how many seniors. I was on the phone earlier, and thank you, Carol, for reminding me of the meeting. But I am one person trying to help these people understand that through Christ, all things are possible. But there's like a rush to judgment. Hurry up, go get your shot. If you don't get your shot, what's going to happen to you? Just like you said in the grocery store, I was in the Giant and they made the announcement over the phone, over the speaker. People started running over to the pharmacy, and it was a madhouse. I refuse to let myself get to that point. I have been online ever since it started. I have no appointment, but I have an appointment with my doctor Monday morning, who is on staff at Doctors, who will assure me he will get me my shot. But that's just one, and I'm a senior with underlying health issues. I put in the chat box that you need to be on Fox 5 or somewhere. Somebody needs to, who does have a heart and compassion for this situation. I'm afraid that someone is going to not only die from having the disease, but just from the stress and the anxiety that this is putting on them. And thank you for letting me have my voice this morning. Thank you.
That's just a great comment. Just indeed, a fabulous comment, because the stress that that we're living with this. There's a new paper out, and that where folk are talking about life expectancy, and generally life expectancy has declined just in this last year, and for Black males, it's up to 3 years less of life, and then it's other males, and then Black females. So life is decreasing. Not only that, the mental health and the stress is also a contributing factor with regard to life expectancy. And so we're looking at now exactly what you said. Folk are literally dying with all sorts of health issues, but I don't want to say they're losing mind, but they're having significant health challenges mentally going through this. And so we've been working with MBI Health Services for a number of years at our location to try to deal with the mental health issue in the community and in the district. And we're finding that it's stressful, and everybody is not using great coping skills. We're seeing upticks in violence, upticks in suicide, upticks in all of these other things, and it's just during this COVID pandemic. So that's something we have to pray on. We have to allocate resources on. We have to look at how we train more about this. And we really have to look at, when I say resources, we have to look at the dollars allocated, because if we don't, we're going to, as African Americans, Black folk, we're going to catch some of the toughest and roughest end products of all of this other trauma and all of the other pieces that we have to contend with. And it's unfortunate. It's very unfortunate. So I still encourage folks to exercise where you can in your house. Make sure that you continue your reading. What are you reading? Keep your mind engaged, because here's the thing with regard to COVID, and Dr. Callender would know well, there are some that are called long timers, and those long timers are dealing with effects of brain fog. And the way folk have to deal with this is working the brain so that it can think, it can reason, it can read, and that helps clear up the fog. I tell the same thing to those who deal with dementia. Keep a book and struggle through that. I know it's difficult, I know it's painful, but keep doing that, because that will continue to make you stronger.
Dr. Curry?
Yes, ma'am.
One of the things that is, number one, I applaud you. I'm with this group. I think too, you should be on Channel 5. Your voice is so powerful and you're so clear in your explanation. But at the beginning of this pandemic, what we are hearing and registering, we're giving it to the seniors. The seniors are first. I've had several appointments. Nope, we can't take you now. We're doing 75 and over. I live in PG County. PG County just opened up the new Six Flags vaccination group. Right across the street, walk out of Six Flags, right across the street, senior citizens, Cameron Grove, they were begging. They didn't know how to vaccinate. One of the main sources of vaccination or registering is through the Maryland PG County, and you tap into Luminous.
Right.
I've had several phone calls from Luminous with appointments, and then they canceled because of seniors. I would keep redialing. Each time I redial, I mentioned the seniors at Cameron Grove. Lo and behold, last week they came to Cameron Grove to sign up seniors for vaccination, which is wonderful. I don't know if they came back yet. They said they would come back to vaccinate, but it's the outreach of what they need. And I think obviously in the start of all of this, it was an urgency to get the vaccines out, but process probably wasn't thought through clearly. And to get to the seniors, you have to go to the seniors.
Correct.
You don't ask them to come to you.
Right.
Correct.
And with me living in that area, the lines are long at Six Flags, but no seniors.
Yeah,
Yeah.
I know it well. My mother-in-law, before she deceased, she lived in Cameron Grove, so I know Cameron Grove
Okay.
very, very well.
Right.
And one of the things we have to understand is, sadly, sad but true, is that society orients itself around those in the middle sections of life. So the seniors and the children are generally somewhat thought of last, and those who can maintain life and are doing all the tax payments and all of the other things, those are the ones that they really shoot for in terms of having things organized around them, because generally that's where they are. The organizers are generally in the same, they organize around within their own age group, plus or minus so many years. And that's something that folk are having to think about and having to advocate for. That's why you must have senior advocates. You must have clear definition with regard to the young and when the vaccine is cut off for them. And right now, most folk are saying 16, some say 18. So that area between 18 and let's say 60, really, that's who they're targeting. Now, those that are 61, 65 and above, they haven't addressed those issues. That wasn't clearly, thought through. And so that's where the advocacy has to really come into play. And we have to really let folk know through our senior groups, through AARP, through your other senior circles, through your churches, that we need additional care. Yes, ma'am.
Good. Thank you.
Yes, ma'am.
Dr. Curry,
Yes, sir.
I told the group today that there was a Black lady around 50 who died after getting the vaccine. What is your feeling after hearing that information?
Yeah, I do know that there are some side effects that we don't know, and we have to own that. But as one doctor told me, if you get the vaccine and you have anaphylactic shock, then I can work with you and you have a greater chance of life. But if you don't take the vaccine and you get COVID, there's absolutely nothing I can do but give you a ventilator and treat the conditions. Because the way COVID is working in bodies, it is causing your immune system to go into hyperspeed and try to work to take things out, to try to fight the virus. And as such, what's happening is folk are dying not strictly due to COVID, but they're dying due to heart attacks and strokes and kidney failures and other sorts of things. And so I do believe that you are best suited and the highest probability of success for you to have a continued life is, first of all, faith in God, of course. But I do believe that you need to look at considering the vaccine. I've taken my first dose as a credible messenger, and I believe I feel fine. And I'm looking forward to my second dose the week of that I should take it March the 11th. And I'm just looking forward to seeing more of us take it, because this is a matter of life and death. And when it comes down to the variants, we're going to see this like never before. The South African variant, the UK variant, those others are getting more and more, the virus is getting more and more aggressive in terms of transmission, but you need some modicum of protection with regard to what these vaccines give you.
And I had concluded that what this means, it's more urgent for us to get the message out.
Yes.
That if you really love yourself and want to take care of yourself, you need to get the vaccine. And so it's even more important now than ever before to address the community and get them to understand the vital need for the vaccine. Any other questions? Yes.
I have one question. And good morning, Dr. Curry.
Good morning.
And Dr. Calendar. You know, before we had sanitizing everything, you know, churches, if they had someone to come in, they had to sanitize the whole thing completely. And I don't know how it's affecting the schools. They're letting children in, but the sites where they're giving the vaccination, and you see everybody, if you touch something, then somebody instantly wipes it with a rag to sanitize it. What are they doing with these facilities where they're giving shots? I don't hear about it as much as they're sanitizing. You know, you can touch doorknobs and this and that. Couldn't bring your groceries in without scrubbing them. So what are they doing about the sites? And I was hearing
Great
Sylvia
question.
was talking about that they had mobile things. You can't sanitize all of that stuff and then still give these shots. So what's going on?
So right now, in those massive sites, what you try to do is keep most of everything outside. And then during the observations areas, you try to keep everything wiped down. Everyone has to have a mask and be socially distanced. But other things that go on, they actually fog areas and spray. They actually make sure that everything is hands are washed and there's plenty of hand sanitizer. But to be honest with you, it's impractical to try to fog every single location after every single person. And that is where some have some issue. And so how long is the residence time of the virus itself staying on surfaces? The best we can possibly do is wipe down, make sure that we have the right air exchanges in the room. And if you have capabilities, put certain types of filtration systems in for those air systems. And that's where we are. I say that, but because even in getting the vaccine, there's still a chance of one getting COVID or contracting the virus. And we're going to have to do a better job of making sure that the places are not only clean, like you're raising, which is an excellent question, but we're going to have to make sure that everything in the supply chain, even you getting out of the house to getting in the car, to being around other people, we're going to have to do better. And the vaccine will help us with that over time.
What expense does your church have to go through to have the site where people are coming in to get the vaccination?
Well, what we've done is we've had our own custodial staff, and we've had others that have volunteered, that have sort of cleaned the building, if you will. That's what we've used so far, because we're doing a pilot. If we do this on a more consistent basis, I have some information on how we buy our own equipment and move forward from there.
Well, thank you very much, Dr. Curry. This has been an incredibly awesome experience. You've done a magnificent job, and we can't thank you enough for taking time out for us and to spend so much quality time with us. And so all I can say is, once again, being with you has been an incredible experience.
Well, thank you all. And
look forward to seeing you on Friday.
Oh, all right. Take care.
Thank you.
Thank you.
All right. You all be blessed. Thank you so much. And I'd love to talk to you again. Be well.
Okay. Thanks.
Thank you.
Bye.